welcome to my YouTube channel, and I am Dr. Nauman. Guys, in today's video, we will discuss the medications that is used in depression. Medications used in depression. So guys, I want to tell you that depression depression is a very common disease nowadays, and at least one or second person is mostly affected and mostly suffer from depression like disease. And I think this is almost common disorder and common disease in nowadays and in everyone. So, guys, I want to tell you that what is depression and what happens during depression inside human brain. So, I want to tell you the basic mechanism of depression, that there are some certain hypotheses which is given about the depression. In some hypotheses, they say that it is also the imbalances of noradrenaline. Noradrenaline. Some hypothesis says that it is the imbalances of serotonin. Some says it is the imbalance or the unequilibrium state of dopamine. But the actual hypothesis and the actual thing is that it is the imbalance of glutamate plus GABA. These are the two chemicals that play important role in mood changes, mood elevation, pleasurement. So, guys, in depressive state or in depression, the brain glutamate or GABA level is disturbed by some certain kind of causes or some kind of events or some kind of complications. So what we have to know right now is on a chemical basis. So on a chemical basis, the depression inside the brain, there are two chemicals. The one is glutamate and the second one is GABA. And these two chemicals play important role in mood elevation and the pleasurement and the concentration and also the activities that is performed by a person. So my main objective is to elaborate the medication and their mechanism of action, the activity, that what are these kind of medications and how it can play their work, their function inside human brain. So guys, the thing is, the medications, that is citalopram, fluoxetine, paroxetine, fluvoxamine, and many more. So these are a class of medicines which is known as SSRIs, means selective serotonin reuptake inhibitors. Now guys, the main fact and the main mechanism of action of these medication is that it will block or inhibit the reuptake of what? The reuptake of serotonin. यानी I mean, this kind of chemical will be inhibited by these drugs for reuptake. Now, when these drugs will inhibit the reuptake of serotonin, so ultimately the serotonin level or dopamine level or glutamate or GABA level will ultimately be increased inside the human brain. So the person will feel relaxed, the person will take more and more interest in activities. Also, it will take interest in interacting communities, friends and families, and daily tasks, and many more. So this medication is also used in depression also, because these are the medication which is used in depression. And uh, this is the easiest and simple mechanism of action of antidepressive medicines. So whenever these medicines will inhibit the uptake of serotonin or dopamine or glutamate or GABA, for guys, actually these kind of chemicals or much something different from these, because for these chemicals another special type of medications are used, that is known as antipsychotic drugs, just like olanzapine olanzapine or carbazem and such like medicines, that is used in the maintenance and to keep the level of glutamate or GABA inside the brain constant. So this is somewhat different, but the actual medicine that is used in depression is the escitalopram and all these, and their mechanism of action is very simple. It will goes inside the brain, and in the brain it will block the reuptake of serotonin between the neurons, just like this is the one neuron, right? And this is the another, sorry, this is the another neuron. So guys, in between these gap junction, the serotonin is produced, perform their function, and will reuptake by these neurons. So the main mechanism of action of this medicine is performed, or here between these junction. These medicine will come here and will block the reuptake mechanism of these chemicals. So whenever the reuptake mechanism of these chemical is inhibited by such like medicines, so the serotonin or dopamine level is ultimately increased inside the brain, and the person will feel relaxed, the person will feel calm and cool, and also the person will take interest in many of their daily life activities, and it will look fresh and happy. So and the mood will also be happy, and these medicines play an important role in such like disease, just like depression. So guys, the today's video is very short and the brief discussion of such like medications. So if you guys like the video, so subscribe my channel, and also like the videos and share it with your friends and families. And my video ends up. I will see you in the next video. So for now, that is enough. Take care. Goodbye.